Welcome to Health Professional Radio. Glad that you could join us. I'm your host, Neal Howard, and we're going to have a conversation this morning with oncologist Dr. Melissa Wilson. And she's joining us today to talk about melanoma, the risk, and some of the latest research and resources associated with it. Welcome to the program, Dr. Wilson.
Hi, thank you.
So I mentioned that you're an oncologist. Where are you practicing? And talk a little bit about your normal patients.
So I practice at the Perlmutter Cancer Center at NYU Langone Health, and I actually see patients with all types of skin cancers, so including basal cell, squamous cell, and Merkel cell carcinoma, as well as melanoma. And melanoma is the majority of the practice of the patients that I see. I see patients who I are just monitoring for recurrence, so screening and surveillance patients, as well as patients who have metastatic melanoma who are undergoing treatment.
Is everyone susceptible to melanoma, or are there certain factors that make some people more susceptible than others?
Certainly everybody has the potential of developing melanoma, but there are certain characteristics that predispose certain patients to develop melanoma. One of them would be a family history of melanoma, and some of these are tied to specific genetic changes, and some of them are not. And then there are certainly patients who have fairer skin, so blonde hair, blue eyes, red hair. Those characteristics seem to predispose patients to developing melanoma. Now, we certainly have patients who have other types of melanoma, so mucosal melanomas. Those are not sun-related, but patients can develop that as well. And then certainly the biggest predisposition to developing melanoma is UV exposure, whether being natural sunlight or tanning beds.
In your experience, how many people would you say are dealing with melanoma that is a result of exposure to the sun?
So about 90,000 patients per year.
Wow. Every year. And when it comes to cancer,
right,
is it as serious as some of the others that we hear about more often?
Sure. So, even with that number, melanoma is actually considered a rare cancer, but it is increasing over time. So each year we see new cases and more cases, and this is in the setting where other known cancers are actually decreasing in incidence. So melanoma continues to increase. And while I had spoke earlier, while about 90,000 patients will develop melanoma in 2018, it's only about 1% of those patients that will die from melanoma. It is a serious cancer. Generally, we feel that patients diagnosed with earlier stages have a higher risk of cure for their melanoma. But since 2011, we've seen remarkable treatment opportunities come up for patients, and we are actually starting to see patients who are responding to the treatments that we have and have durable responses, meaning the response lasts a long time, and we have actually even had patients have complete responses, meaning their melanoma goes completely away. And this is new in the field of melanoma. Prior to 2011, the prognosis for disease that had spread to other sites or metastatic melanoma was pretty poor.
So being considered relatively rare, but still very, very serious, what would you say is one of the main factors that is causing this increase that you say since 2011, 2012?
So it's hard to really pinpoint what specifically has changed. Certainly there are a number of environmental factors that go into melanoma, and increased sun exposure is one of those environmental factors. People nowadays, we travel a lot more than we used to, right? So we're going to a lot more sunnier areas than when we didn't really travel that much. We had the summertime when we were sun exposed and then winter time when we didn't. So that certainly can be a change. So it's like environmental as well as lifestyle. Certainly we're seeing a lot more use of tanning beds, and so that certainly is something to be taken into account when we see increased melanoma incidence, as the use of tanning beds has changed. And then this is all on top of any underlying genetic factors.
Would you say that maybe age plays a role? Because as we age, we become susceptible to so many other things that we weren't necessarily a candidate for in our 20s and maybe even our 30s. Is that a factor, or is it just anybody's susceptible?
Well, certainly certainly age can play a role, and we do see probably the average age of patients being diagnosed with melanoma is in about the 60s, like around 63 to 65. However, we do feel that it's exposure earlier in life that predisposes for the melanoma. So we're very concerned about sun exposure and actually sunburns in patients when they're in the puberty stage, because the skin is very sensitive at that time. And it's possible that one bad sunburn in the puberty stage can actually predispose you for melanoma and development of melanoma later on in life.
You mentioned several promising treatment options that have become available of late. What would you say, in your opinion, is, I guess, the most exciting treatment option for melanoma?
So there's actually two. So one is immunotherapy, and the other is targeted therapy. And these are the two areas where we've seen remarkable responses to treatment in patients. So immunotherapy takes the patient's own immune system and turns it on to attack the melanoma cells. And so the newest development immunotherapy is what's called checkpoint inhibitors. So the body has a way to turn the immune system on when it needs it. So if you get sick, you get the flu, you get a cold, or if you get a vaccination to make antibodies. But then it has a way to turn the immune system off when you don't need it, because overactive immune system is what leads to autoimmune disorders. And the simple way to describe it is the way the body shuts the immune system off, it puts up some stop signs in the life cycle of white blood cells, and specifically T cells. And it tells them stop. And so our new therapies, immunotherapies, actually are antibodies that bind and block these stop signals. So essentially you're inhibiting the inhibitory signal. So you're revving up the body's immune system to let the T cells attack the melanoma. So with targeted therapy, sometimes in tumors we find genes that get broken. And what happens when that gene is broken, it makes a protein that is on all the time, and that protein drives the melanoma cell, to continue to grow. And by using targeted therapy, they're generally pills that patients take, they can block those signals that are driving the cell and stop the cell from growing.
Let's talk about some of the steps that folks can take to prevent melanoma.
I call them safe sun practices. Okay. So people don't have to be hermits, but they really should take care of themselves when they're out in the sun. So, sun protective clothing, hats, using sunscreen, using enough sunscreen, right? So sometimes we don't put enough on, reapplying sunscreen if they've been sweating or in the pool or in the ocean, or just in general, after a certain period of time, reapply sunscreen, and to stay out of direct sunlight from between 10 and 4. There's something, that's really one of the things that patients can do, and they can teach their children to do that, because a lot of what we do as an adult is a habit, and what we did as, when we were younger. So really teaching our children to do this as well, and then really being screened by a dermatologist yearly for mold checks, body checks, skin checks, to see, to make sure there's no mole or lesion that looks funny or changing.
Well, where can we go and learn some more?
So the American Cancer Society has a website, so www.cancer.org. There's the Melanoma Research Foundation, www.melanoma.org, and then the Melanoma Research Alliance, www.curemelanoma.org.
Dr. Wilson, thank you so much for joining us today on the program.
You're welcome. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes. You can listen in and download at SoundCloud, and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.